Good evening, everyone. So, dear friends, whenever we are doing treatment as per the TCM, whenever we are planning any treatment as per the TCM, just we have to remember mainly 8 point, on mainly 8 point. So, you focus on these 8 point. So, the 5 points are the points of 5 elements. So, out of 8 point, we have to remember 8 point for planning any treatment. So, from every meridian, we should know just 8 point for doing any treatment. So, the 5 point will be the 5 element point. Now, other than this, one point will be point for the ICU management. ICU management. Or the other name of this point is G cleft point. So now the 5 and 6, 5 and 1, these has become the 6 point. Okay. Now the next point we should know the Leo connecting point. I will discuss more about this point, the Leo connecting point. So 5 plus 6 and 7. Now, the final point we should know, that is called source point. So 5, 6, 7 and 8. So in every meridian, we are having 6 point. 1, we are having 8 point. 1, 2, 3, 4, 5, 6, 7 and 8. And if we are having the idea of these 8 point, like 5 points of the 5 element, 1 point for the ICU management or the G clef point, 1 point is the Leo connecting point, and the last point is the source point. Then we can plan any treatment anywhere in the body. So now, in the human body, we are having multiple meridians. So if suppose this is the human body, in the human body, we are having multiple meridians. So the some meridian are in the upper part of the body, and some meridian are in the lower part of the body. So whether the meridian in the upper part of the body or the meridian in the lower part of the body, we should always remember these 8 point. These 8 point. So the 5 element point and the G clef point or the emergency point or the source point and Leo point Leo connecting point, and the source point. For making it little more easy, we can also simplify this, and we can tell in this way. If we want to plan the treatment of any problem, then we should have the idea of 5 element point plus lusoxy, lusoxy, lusoxy. So remember this formula of lusoxy. So the 5 element plus lusoxy. The meaning of Lu means Leo. The meaning of So means source. And the meaning of C is the G cleft. So if we even remember the formula 5 element plus lusoxy, lusoxy, then we can make the protocol for any problem in the body. In the my classes here, we are learning the protocol management part. We are making the protocol for any disease in this method only. So suppose we were discussing about the lung meridian. In the lung meridian, we are having 5 element point, that is lung 11, lung 10, lung 9, lung 8, and lung 5. What is these all? In every meridian, we are having 5 element point. Like in the lung meridian, we are having 5 element point. So the meaning of this, the lung 11 is having characteristic like a wood. The lung 10 is having characteristic like a fire. So if we stimulate the lung 10, we can increase or decrease the fire. If we stimulate the lung 11, we can increase or decrease the fire. We can stimulate the lung 9. So this is the earth point. The lung 8 will be the metal point, and the lung 5 will be the water point. So suppose we want to stimulate the lung 5. So with the help of lung 5, we can increase the water in the lung meridian, or we can decrease the water in the lung meridian. So the lung 5 is the water point, lung 9 is the earth point. The meaning of earth is stability. Stability. So we can increase the stability or we can decrease the stability via the lung 9 point. So lung 9 point is the point who is making the lung meridian stable. Sometimes we need to increase the fire in the lung, and sometimes we need to decrease the fire in the lung. So with the help of lung 10, we can increase the fire or we can decrease the fire in the lungs. So these are the 5 element point of the lung meridian. So if we write down all the points in the line, so even we can line in this way. So this is the lung meridian. And in the lung meridian, we are having 5 points. So this is the lung 11, this is the lung 10, lung 9, lung 8, and lung 5. So lung 11 is the wood point, then in the sequence, fire, earth, metal, and water. I told you if we remember the 8 point in any meridian, then we can plan the treatment of any disease. So other than 5, we have to also remember the name Lu-Soxi. Lu-Soxi. So what is the name of Leo connecting point of the lung? What is the name of source point of the lung? What is the name of G cleft point of the lung? Just we have to add these 3 more points, then we can do anything and everything in the lung. Because we can increase the fire, we can decrease the fire, we can increase the stability, we can decrease the stability, we can increase the water, we can decrease the water with the 5 element point, and whatever and many things we can do with the help of these points. Because if we talk about the Lu-Soxi, so Lu-Soxi means, I told you, the G cleft point means emergency management. We will also learn the meaning of Lu-So. Lu-So. Okay. So is it clear? Till now, it is clear. Till now, it is absolutely clear. I need reply from all of you so that I can understand your. Yes, it is clear. Wonderful. So in every meridian, we are having 5 plus 3 point, 5 plus 3 point, 5 plus 3 point. In every meridian, we are having the 8 and 8 and 8 point. Okay, not a problem. Fine. So let's take about the example. If we talk about the 5 element here, if we talk about the 5 elements, then the 5 element we are having. So now, in the 5 elements, we know this is the metal, and this is the water. This is the wood, fire, and earth. So the metal is lung. The water is kidney. The wood will be liver. The fire will be heart as well as pericardium. The earth will be spleen. Now, whether we talk about the lung having 5 element points plus 3 points. So, in the lung meridian, we are having 8 points. Even in the kidney meridian, we are having 8 points. Even in the liver meridian, we are having 8 important points. We are having many points, but I am talking about the very, very important 8 point. Even in the heart meridian, we are having 8 important points. In the spleen meridian, we are having very, very important 8 points. So in every meridian, we are having 8 very important points. Let's see the example of kidney. Let's see the example, or let's see the example of heart meridian. Let's see the example of heart meridian. So suppose this is the heart meridian. The meridian is moving like this. So the first I will tell you, in the heart meridian, or we are having 5 points of the 5 elements. So the 1, 2, 3, 4, and 5. So suppose we want to increase the Bud energy in the heart. Bud means the energy like a child. Bud means like child is jumping here and there. We want to increase lots of energy in the heart. So the first point will be heart 9. The heart 9 means Bud point. So if we stimulate the heart 9, we can increase the Bud energy. So we can increase or decrease the Bud energy in the heart meridian with the help of heart 9. If we tonify the heart 9, it will increase the Bud energy. If we sedate the heart 9, it will decrease the energy. In the same way, the second point will be heart 8. The heart 8 will be the fire point in the heart meridian. So we can increase the fire energy in the heart meridian, or we can decrease the fire energy in the heart meridian with the help of this point. The heart 7 will be the earth point. Heart 4 will be the metal point, and the heart 3 will be the water point. Suppose I want to cool the heart. I want to cool the heart. I want to bring the water energy in the heart. I want to bring the coldness energy in the heart. Then I can stimulate the heart 3, which is the water point. So in this way, these are the 5 points. Even we can show in the form of this circle. So this is the heart meridian. So we are having 5 points, 3, 4, and 5. So in this 5 point, we are having the heart 9 will be the Bud point. Heart 8 will be the fire point. Heart 7 will be the earth point. Heart 4 will be the metal point. And heart 3 will be the water point. So in heart meridian, we are having very wonderful facility. You can increase the Bud or decrease the Bud. You can increase the fire or decrease the fire. You can increase the earth or decrease the earth. You can increase the metal or decrease the metal. You can increase the water or you can decrease the water. So you know the heart 3 point comes here. This is the location of heart 3. So this is the location of heart 3. Suppose I am pressing the heart 3. Look at in this image. So look at in this image. 1 minute. So this is the location of heart 3. So I have seen and I have already told to my many of students, suddenly BP become high and you want to cool the heart. Then what to do? You press the heart 3 point. If you press the heart 3 point, so on the other side, you can also hold this other side. We will discuss this point also later on. So on the one side, you can hold this crease. On this side, you can hold this crease. And if you just press these 2 points, then you will see the BP will reduce within few minutes. So you can reduce the blood pressure just by stimulating this heart 3 point. And the last class we have already demonstrated how to needle this point. But many of my participants and many of my students has been given me very good feedback. Even I have tried to many of my patients, and I am telling to my patients in the home they can do regular pressing or acupressure on this point. So where the inner crease of this elbow, keep the thumb here. On the other side, keep other finger there and just keep on pressing like this. So this is a wonderful technique to reduce the blood pressure, because with the help of heart 3 we can bring the coldness in the heart, because heart 3 is the water point. Is it clear? Can you press this point? Can you do the acupressure on this point? So whether you will able to do the pressure on this point? Yes. Okay. So suppose suddenly you are getting some patient who is suffering with the blood pressure So you can press this point immediately, and or you can suggest the person do himself or herself, and you will see the person is getting cool down effect in the heart. The heart is cooling down, and the person will get very good relaxation in the heart. Now, we can also do some other thing. What is the other thing? We are pressing the heart 3 point, then we can bring the coolness in the heart. In the future, when we will learn about this point, then we will learn about this point in the future. That time you will learn the effect of this point. The effect of this point in the outer crease, we are going to learn in the future. This point is very wonderful for high blood pressure. This point is very good for high blood pressure. So we press this point in the lateral crease, in the outer crease with the inner crease. So we press both the point together, then we can expel the unwanted heat out. So exactly this point will expel the heat out, and this point will bring the coolness in. With the help of both point, we can reduce the blood pressure. So in this way, this is the effect of the 5 element point. So heart 3 is the very good point, water point. So we can increase the water in the heart, because sometimes what heart is the place who is pumping blood throughout the day and night. But sometimes heart becomes too hot, too warm when we are not sleeping enough. When we are not sleeping enough, then heart become very hot and warm. When we are not taking proper relaxation, or we are suffering with the insomnia, or we are going through with some disease, heart become hot and restless. That time, with the help of heart 3, just by pressing this point, we can increase the energy in the heart meridian. Or even we can go in the more easy way. We can take the dark blue color, or we can take the black color, and we can put on the location of heart, this water point. Because the dark blue color is the color of water, the dark blue color is the color of coldness. Like we see the, if you see the water from the distance, the water looks like blue. That's why our this earth is called blue planet. This earth is called blue planet. If you see this earth from the moon, our earth is look like a blue planet, because in the earth we are having more than 70% water. So the color of water is dark blue, or the color of water is black. Even we can put the black color here on the heart 3 location, and we can cool down the brain, cool down the mind in that way. So we can put the black color here, as well as we can put the black color here. This is also the very wonderful for increasing the, for decreasing the blood pressure. Okay. Now in the traditional acupuncture, what will do if someone is suffering with a headache, migraine, or vertigo? If someone is suffering with a headache, migraine, or vertigo, then what we can do? Suppose one patient is suffering with a headache, with a migraine, and the vertigo, giddiness. The person is suffering with the giddiness, headache, migraine, and vertigo. Then what we can do? So we have to follow the same procedure, because the migraine headache because of the restless heart, the headache because of the restless heart, the vertigo, if you, and especially I would like to tell you the giddiness. So this, the point which is in the outer side, it is expelling the unwanted air out, unwanted wind out. So the combination of these 2 points on the elbow crease, on the elbow crease, if you stimulate the points on the outer crease and plus on the inner crease, which I told you, heart 3 or water point. So with the help of these 2 points, you can treat the headache, you can treat the migraine, you can treat the vertigo, you can treat the giddiness. or high BP. So we can do this now. So in this way, if we look at this chart, so this is the heart 3 is the water point. Okay. Now let's talk about the heart 8. The heart 8 is the fire point. The heart 8 is the fire point. Got it? So we can increase the fire in the heart or we can decrease the fire in the heart with the help of heart 8 point. Suppose if you want to increase the fire in the heart, so what you can do? So you should be aware with the location of the heart 8 point in our palm, so look at this is the small finger, ring finger, middle finger, index finger, and the thumb. So suppose this is the wrist and we are looking the palmar side. So we are looking the palmar side. I want to tell you the importance of the heart 8. And the palm, if you look at the palm, in the palm we are having one line here. This is called heart line. Okay. So now, if from this is the small finger and this is the ring finger. If we draw the line from the midpoint of the small finger and ring finger and going like this, so where this line intersect this horizontal line, this is the location of heart 8. And this is the fire point of the heart meridian. So with the help of heart 8, we can increase the fire or we can decrease the fire. So how can we increase the fire and how can we decrease the fire? What is the method? Suppose if you want to ignite the fire, then you have to touch the point very smoothly, very gently. You have to do the point like this. Oh point, please get up. Hey point, please get up. Ignite the fire. So we have to touch the point very gently. So we'll touch the point very, very gently, very smoothly. Okay. Or we can put the needle in the direction of energy flow because in the heart meridian, the energy is coming like this. The energy is coming like this. So we can insert the needle in this meridian in the direction of energy. So we can put the needle in this direction. So if we put the needle in this direction, so it is called tonification. It is called tonification. Means increasing the energy. So the meaning of tonification, whether we will insert the needle in the same direction or we are touching the point with the gentle touch, then also suppose we are just doing the acupressure, we are not putting the needle, so just with a gentle touch, we can ignite the fire energy. Now, suppose if we want to reduce the energy, so what we will do, the number one technique, we will put the needle in the opposite direction because we want to reduce the energy, so we'll go on the direction of opposite. We will put the needle in this direction because the energy is coming like this, but we want to reduce the energy, so we'll put the needle in the opposite direction if we want to set the fire energy. Or if we just want to do this technique with the acupressure, then we will do in this method. Look at my hand. Suppose this is the heart point. If I am touching this point with the love, with gentle touch, it is the tonification. Or I am stimulating and giving the acupressure very gently. This is the tonification. But if I want to reduce the energy, then I will press this point with the cruelty, vigorously, like this. So if I'm pressing the point with too much pressure, that is called reducing the energy, sedation of the energy. So the question is asked, why, how, what about the low blood pressure? So in the low blood pressure, we will increase the fire energy. So we can put the needle in the same direction of the energy flow. So we can able to increase the fire energy. So when we increase the more fire energy, it will increase the pressure, then the pressure will be normal. But if we want to reduce the fire energy, then we'll put the needle in the opposite direction. And when we will put the needle in the opposite direction, we can reduce the fire energy. Now question comes, why to reduce the fire energy? Okay, can you tell me, can anyone have idea when we have to reduce the energy in the heart? What is the problem? What is the problem of the patient when we need to reduce the energy of the heart? What is the problem? In which disease we have to sedate the energy of the heart? So this is the right number one, high blood pressure. This is the right thing. If the person is suffering with a high blood pressure, so we need to reduce the energy of the heart. What is else? Anything else other than high blood pressure? So if someone is suffering with the high BP, okay, then we will reduce the energy of the fire point. So reduce the energy of the fire point. What else? Anything else do you have in your mind? The second thing is hypertrophy. Yes, right? Perfect. The hypertrophy means there is a thickening of the wall of the heart. So that is also right. If there is a hypertrophy of the heart, the meaning of the hypertrophy, now the walls of the heart become thicker. So we have to reduce the fire. Anything else? Palpitation, wonderful. So if someone is suffering with the palpitation, we have to reduce the fire. Anything else? If you have in your mind, tell me. So I will tell you a few more things. So let's see here. If someone is having the ulcer on the tongue ulcer, tongue is under control of the fire. So in the condition of tongue ulcer, also will reduce the energy of the heart, because heart is controlling our tongue. What else? Because heart is controlling your tongue. So think, if the heart is controlling your tongue, so when you speak, you are speaking because of the energy of heart. So what will happen if the person is speaking the heart energy will increase, then how the person will speak? Tell me. What will happen with the speech of the person? Whether the person will speak a lot or the person will not speak if there is excessive heart energy. So if there is excessive heart energy, then person will speak a lot, too much speak, because the tongue is having too much fire. So the person will keep on speaking, keep on speaking, keep on speaking. He will not stop. He will keep on speaking. It will be very difficult for the person, because sometimes many person are talking unwanted talk. They are doing unwanted talk, even we don't like. But he's talking and talking and talking. That is also because of the excessive energy in the heart. I have seen many patients are suffering with the depression, and for the long time they are suffering with the depression, and suddenly they are forcefully coming out from the depression forcefully, but deeper inside they still have depression. So now they are trying to express their jolliness, their happiness among the world. So they are always looks like jolly, they are always looks like friendly, and they're talking a lot because I am facing every types of patient in my clinic. So the person is coming, sitting in front of me, talking a lot, talking, even not stopping. But if we go in the history, then we'll find these persons were passing with a very depressive period in their life, and suddenly they have changed. Now, right now, there is excessive heat in the heart, that is also illness. So we should be talkative, but we should talk only that much which is needed. If the person is talking a lot, so if person is become more talkative, then also it is a sign of excess of heart energy. Then we have to sedate the fire point of the heart. So we'll sedate the fire point of the heart in the condition of high blood pressure, in the condition of hypertrophy of the heart, in the condition of palpitation, in the condition of tongue ulcer, in the condition of someone is more talkative. So in these all conditions, yeah. See, if we are talking in two ways. Uh, talking loud may be considered in a different way. See, if the person talking a lot, that can be considered in the heart. But the person talking loudly, that will not be considered in the fire. We'll discuss that thing later on. Because talking loudly is a different thing, and talking a lot is a different thing. Talking a lot means he is not stopping, talking for 30 minutes, for 1 hour, for 1.5 hours. That is talking a lot. That is because of the fire energy. But the person talking loudly, hey, listen me, loudly, that is the different thing. Okay. So we'll discuss this thing also, why the person talking loudly. So suppose someone is suffering with a low blood pressure. If someone is suffering with a low BP, then what we are going to do with the heart rate? We will tonify the heart rate or will decrease the heart rate. If the person is suffering with the low blood pressure, then we will do the tonification or the sedation, means will increase the energy in the heart rate or will decrease the energy in the heart rate if someone is having low blood pressure. Tell me. If anyone having low BP, then we will increase the energy or the decrease the energy. Tell me. And also, so definitely we will tonify, we will increase them. Very good, wonderful. So now someone is suffering with a low BP. Now, suppose someone is having, oh, I don't want to speak, I am tired. Someone is telling you, I am tired, don't want to speak, don't want to speak because I have worked throughout the day from morning to the night in my office. Now I am too tired. Please do not tell me to speak. Kids are pulling your shirt. Kids want to play with you in the home, but you are telling no, enough for today. I have worked a lot. I have worked a lot mentally. Now I am tired. So in this condition, you will increase the energy of the heart or decrease the energy of the heart. Tell me. So we are going to increase the energy of the heart, definitely. We will increase the energy of the heart. We will do the tonification in both the conditions. Suppose if someone is suffering with the speech disorder, or it is called aphasia. Someone is suffering with the aphasia condition. Aphasia means unable to speak. The meaning of aphasia means not able to speak because of any reason. Whatever the reason, we don't know. Maybe it is because of the paralysis, or maybe it is because of the mental illness, mental retardation, whatever the reason. If anyone is not able to speak or suffering with the aphasia, then what we are going to do? Definitely, we will increase the energy, we will increase the fire energy. So we'll do the tonification, we will increase the energy. So in this way, we can we can increase the energy of the heart rate, we can tonify the heart rate. If we tonify the heart rate, we'll able to increase the heart energy, and with the help of this, we can do whatever we want. In that way, if we talk about the 5 element point, so in the 5 element point, like we told, the heart 9, heart 8, heart 7, heart 4, and the heart 3. These are the 5 element points. Other than this, I told you we are having 3 more points. So just remember again and again, we are having 3 more points, so that it will become very easy in the future, because we have to add few more points as per need. So in this way, the heart is the fire. Heart is the fire. In the fire, this is the wood point, and this is the fire point, this is the earth point, this is the metal point, and heart 3 will be the water point. So the every meridian having one horary point, and with the help of horary point also, we can increase the energy on the respective meridian. So tell me, what is the name of horary point of the heart? What is the name of horary point of the heart? So if we tonify the horary point, then also we can increase the energy in the heart meridian. Because if we tonify the horary point, so during the organ clock time, it will receive the energy from the cosmos. So if we tonify the horary point, we will able to receive the energy from the cosmos. So heart is the fire point. So which is the horary point? The meaning of horary point, where we have satellite or where we have antenna, so we can receive the energy from the cosmos. So definitely in the fire, because heart is the fire, so in the fire we are having fire point, that will be the horary point. So heart it is the horary point, and on the location of heart 8 we are having one satellite or antenna, so heart 8 will be the horary point. So if we tonify the heart 8, we can increase the energy on the heart meridian. So the horary points are very wonderful. Why? Because if we tonify the horary point, if we tonify the horary point, like we tonify the heart 8, which is the horary point, then we can increase the energy, can enhance the energy. Or if we sedate the horary point, we decrease the horary point, then we can decrease the energy. Then we can decrease the energy. So in that way, the horary point can do whatever we want. So we can increase the energy or we can decrease the energy with the help of horary point. The question is asked by Abim Bolaji. What if someone is suffering from the high BP and is tired, not want to talk? What do I do? So see, if someone is suffering with the high blood pressure, so definitely first we have to look the high blood pressure. First we have to focus the high blood pressure. because the person is suffering with the high blood pressure even may get tiredness. Okay, so the person suffering with the high blood pressure, first we have to think about the high blood pressure, because person doesn't want to speak. There may be many causes. Even we are having the excessive energy in the heart, and we may get tired. So in that condition, we cannot increase the energy of the heart just on the account that person doesn't want to speak. So first we have to focus on this vital numbers, like the BP is very high, so we will control the blood pressure. So if someone is having high sugar, high blood pressure, and any readings high, so first we should focus on that reading. After that, if the person is not having at all these all conditions, then we can see the symptoms. Oh, you are very tired because you worked in the office throughout the day. Okay, we are very tired because you have speak for 8 hours from, because many times you are having conferences and the person is speaking a lot. Even person is doing lots of work, talking to the talking in the front office, and get tired in the evening time. So that is the heart energy get consumed. But the person having high blood pressure, that time we have to focus on the high blood pressure first. So if suppose someone is suffering with the myocardial infarction, as per the acupuncture, these condition has been considered in the blood stasis. We are going to discuss in the future. See, right now just we are on the very basic steps. Right now we are just on the basic steps. So we are trying to learn the points and the effect of the points. But if you talk about the emergencies, like the myocardial infarction is a emergencies. Okay, so what we are going to do, we will go to the 3 points which I told you we will use during the emergencies. All the 3 points will be used during the emergencies. Suppose someone is suffering with the myocardial infarctions, we will sedate all the 3 points which we are going to discuss shortly. So that's why I told you we can balance everything just by using the 8 point. Right now we are discussing the 5 point. What we have kept separately here, here we are having point which is useful for the emergency management, and the name of that point is, the most important point is G cleft point. The most important point is G cleft point. So we'll discuss about that. But when you learn the acupuncture in very deeper detail, that time you will understand we are making the diagnosis, because myocardial infarctions having, as per the acupuncture, we are telling blood stasis in the heart. That is the diagnosis. But we will understand with the help of emergency point, we will do this. Okay, so now remember one thing, if someone is having emergency, whatever the emergency, like the brain strokes, like the myocardial infarctions, or any emergency, so remember the treatment for the emergencies. So the treatment during any emergency, treatment during any emergency. What is the treatment? So we should do the two treatment number one and the treatment number two during any emergency, whether it is myocardial infarction, brain stroke, respiratory failure, or anything. Like someone is telling you, oh, can you treat my chest pain? You can deal any emergencies just by 2 steps. Step number one and step number two. So let's see the step number one. So the step number one, look at here. So look at this hand, and these are the tips of the finger. Forget the points, forget the name of the point, whatever the name of point, forget them. Just prick all point and take out the few drops of blood, like 2 drops, 3 drops, or 10 drops. Whatever possible, even a single drop blood is like a single pearl. So the first treatment, take out the blood from all the fingertips. Even you can take out the blood from both the hands and both the feet. This is the first treatment during any emergencies, and definitely you will the patient will be normalized very soon just by doing this. So this is called bleeding from the fingertips, bleeding or bloodletting. Bloodletting from finger tips. So this is the first step of treatment. So if you can do the bloodletting from the hands, so do from the both hands. Even this is enough. But if you want to do, even you can do the bloodletting from the fingertips as well as from the toe tips. So you can do the bloodletting from the fingertips as well as the tips of the toes. So in this way, the five finger, so 10 fingers here and the 10 toes in the bottom, in the feet, you can do the bloodletting from all the 20 places. But suppose it's not possible, then just do from the hands. If it is even not possible, then do from any hands. And the most preferably, you should do from the left hand, because left is the yang, which is useful during the emergencies. So just use the fingertips and take out the blood. Forget the point, whatever the name of this point, whether the lung or large intestine, whatever the name of point, forget. Just from the fingertips, from anywhere, you can take out the few drops of blood. So this is the emergency treatment number 1. So look at here. So these are the fingertips here. Just you can take out the blood from the fingertips from anywhere. Just puncture with the needle, not with the acupuncture needle, because from the acupuncture needle, blood will not come out. So you can take the normal needle, which we are using for the injection purpose, and you take out the blood from these points. So this is the first step of treatment. Even we can tell it in our acupuncture language. We can give a very beautiful name, because we know the points found in the fingertips, these points are called Jingwell point. So we can tell the bleeding from Jingwell point, Jingwell bloodletting. Now, this step is very wonderful, but if you apply the second step after this, then whatever the problem, it will be taken care of. What is that? So now, the second step will be, I am telling you, we are having total 8 points, 5 plus 3 points. So now I am telling about these 3 points. So these 3 points are Lu, Sok, Si. Lu, Sok, Si. So we will discuss these 3 points, Lu, Sok, Si. You have to, like if this is a heart problem, then sedate all the 3 points of the heart. If this is the lung problem, then sedate all the 3 points of the lung. If this is the brain problem, then sedate all the 3 points of the brain. If there is a pain in the gallbladder because of the gallstone, sedate, loose, soxy, all the 3 points of the gallbladder meridian. In this way, if you do the Jingwell point bleeding and sedate all the 3 points which is left, which we will discuss shortly, you can take care any types of emergency happening anywhere in the body. Got it? Clear? How can we deal the emergencies? So we have to sedate the Lu, means we have to sedate the Leo connecting point of the respective meridian. Like suppose someone is suffering with a heart attack, sedate the Leo connecting point of the heart. We have to sedate the SO means source point. So we'll also sedate the source point of the heart. We will discuss in the future. And we'll also sedate the G means G cleft point. So if you sedate all the 3 points, then emergency will be taken care. So the bleeding from the fingertips and plus these 3 point sedation will take care any types of emergencies. I think is it clear? Okay. Now, so we were talking about the heart meridian. So this is the heart meridian. In the heart meridian, we are having 5 points. In the heart meridian, we are having these 5 points. So the first point will be wood, the second point will be fire, the third point will be earth, the fourth point will be metal, and the fifth point will be water. So the wood point will be heart 9, the fire point will be heart 8, and the earth point will be heart 7, the metal point will be heart 4, and the water point will be heart 3. And other than this, we are having 3 point Lu Soxi. Lu Soxi. So remember this thing, this is point for the ICU management. So for the heart, this will be heart 5. So heart 5 will be the, sorry, for heart, this will be heart 6. For the heart meridian, the heart 6 is the G cleft point, which is useful for the emergency services. And the Leo connecting point will be heart 5, and the source point will be heart 7. So we can see the heart 7 here as well as the heart 7 here. So this is the common. So what I want to tell you, heart 5, heart 7, heart 6, if you sedate all the 3 points, it will take care all the emergencies. If you tonify all the 3 points, it will lift the energy in the heart very vigorously. So these 3 points are a very wonderful point. That's why I have kept them on the side. If you tonify these 3 points, they will increase the energy in the very great quantity. If you sedate these points, then they will decrease the energy immediately. So always remember these Lu, Sok, Si, and always remember these 3 points in all the meridian. Got it? Clear. So suppose someone is suffering with the aphasia, unable to speak. You want to bring speech back. You can tonify this. Okay, but anyone, suppose someone is having the problem since the birth, so we can't do in like we will put the needle and it will happen immediately. Everything is taking some time as per the root, as per the problem. Okay, so I think enough for today. I think enough for today. Anything I can see the lecturers, but can't hear anything. The quality is bad. So am I audible? Am I audible clearly? Clearly, yeah. क्या करती हो? Fine. So today, so whether all of you are able to understand in this speed, this speed is okay for all of you, or this is also high, because I have to make the speed and everything as per you should understand. Okay. Done. Wonderful. So enough for today. We will tonify for, because when we talk about the tonification and sedation, so remember one thing. Generally, in the acupuncture clinic, we are putting the needle for minimum 30 to 40 minutes. 30 to 40 minutes. But I will tell you one thing, that if you just want to tonification, then even you can take out the needles in less than 8 minutes. 8 minutes. If you take out the needle in just less than 8 minutes, even it will do the tonification. But in the clinic, we are putting the needle for minimum 30 to 40 minutes. Okay, so you can also do that for 30 and 40 minutes. If you want to sedate the point, then definitely we should go more than 15 minutes. We should not go less than 15 minutes. Okay, if we are retaining the needle. So we can go 15 minutes, and in the clinic we are putting the needle generally for 30-40 minutes in that way. So enough for today. Now we'll see you tomorrow. Thank you so much. So if you have any question, you can ask me tomorrow, and hope all of you are able to see the recordings. If any one of you cannot see the recording, you can send me request, or through the Dr. Opiyami, you can send me the request. So I will give you access. Okay. So closing the session now. See you tomorrow. Good night.